Good evening, everyone. It is my pleasure to welcome you all to our monthly webinar and a very interesting topic. Before we go on to the topic, I'll give you a brief introduction about Face Me and an introduction about the speaker and the topic also. So talking about Face Me, founded by Dr. Nirmala Srinivasan, operates at a pan-India level to ensure optimal scope for the delivery of psychiatric services provided by the government, particularly those in urban metros and cities. We operate as a community of family volunteers working for the wellness, security, and dignity of our loved ones under treatment for mental illness. We are an advocacy group and also to mention a few of the projects with the center and state governments. We are working towards with the governments for free ambulance services for psychiatric emergencies and for access of home-based professional psychiatric help and affordable medicines and guardianship in MI. Also, family empowerment and enablement activities, as you know, are webinars with experts in the area. We have zonal WhatsApp groups. We have 4 groups, one in Bangalore, one in Bombay, one in Calcutta, and one in Delhi. And then the main focus of Face Me, the ethos and the flavor, is that we are deeply rooted in the family ethos, whereby we use carer instead of caregiver, loved ones instead of consumers or users, and we talk about the responsibility of care and not the burden of care. I would like to give a brief introduction to this interesting topic that we have today, yoga and mental illness, and how it will help the carers and the PMI. Yoga, with its focus on breath, movement, and mindfulness, offers practical tools to support mental and emotional well-being. This webinar will help us understand how yoga can be a valuable self-care practice for family carers, offering stress relief, emotional grounding, and resilience. It will also explore how simple adaptive yoga techniques can benefit persons with mental illness, supporting mood regulation, body awareness, and overall recovery. Together, we'll discover how integrating yoga into daily life can create space for calm, connection, and healing for all families, family carers, and those who they care for. So both for the carers and for the PMIs. And on this topic, the expert who's going to give her thoughts and guide us is Dr. Aarti Jagannathan. A brief introduction about her is Dr. Aarti Jagannathan has completed her master's in Psychiatric Social Work from Tata Institute of Social Services, Mumbai, and her MPhil and PhD in Psychiatric Social Work from NIMHANS. She is currently working as an additional professor of Psychiatric Social Work, Psychiatric Rehabilitation Services at NIMHANS. Her areas of interest include rehabilitation of patients with psychiatric disorders, especially schizophrenia, human rights of mentally ill, yoga for mental health, dance, art and spirituality, caregiver interventions, and psycho-oncology. She has clinical experience of psychotherapy, rehabilitation, and counseling of more than 2,500 psychiatric in- and outpatients at NIMHANS from 2003 to 2011. She has published more than 75 publications to her credit in the national and international journals and books. She has coordinated MSD, CCRYN, Fogarty, TIS-funded research projects in schizophrenia, dementia, play therapy, and yoga. She helms multiple research projects in the area of yoga, rehabilitation, etc., funded by ICMR, NIMHANS, and the Ministry of Social Justice and Empowerment. She has attended multiple national and international conferences for the presentation of paper and won awards. She is also a recipient of the 5th National Women's Excellence Award 2012, Navkiran Young Women Achiever by the Government of India and Women's International Network. So a brief introduction to Dr. Aarti and her many achievements and work. Thank you, Dr. Aarti, for joining us here today. Over to you.
Sindhuja, may I take the liberty of
Sure,
saying a
ma'am.
few
Sure.
words about Aarti? I can't help it.
Wonderful, wonderful. Sure, ma'am. Okay, sure.
It's my privilege and gives me immense joy. I don't even find it very hard to call her Dr. Aarti. I've known her for so many years. Very strong, influential, inspirational forces to start Face Me. Lot of fights, arguments. She is much younger to me as a student, and I didn't hesitate to argue with her. And then, whoa, why did I not? I should encourage. So, all these various thoughts, very bright, brilliant inputs from her. Really, I'm so grateful to you. And that culminated in the inauguration of Face Me in September 2015 when Aarti was present there. The post-lunch session, Aarti was present, and that was a very nice coincidence. I'm so happy. Many of you may not know the historic connection between Aarti, Face Me, and myself. I'm so happy to have you. It's a privilege and personal, gives me a lot of joy today to have you here, Aarti. And over to you, Saraswati, if you are the person to coordinate further. Please take it forward.
Thank you for your kind words, madam. Very heartening.
My pleasure.
Over to you, Dr. Aarti. You can now take over.
Thank you. I think a very happy evening to everybody and a very happy International Yoga Day to one and all. And today I'm going to share a couple of my work that we have done at NIMHANS in the space of yoga for mental health for both families as well as for users. Some of the studies that we have done. And I have also shared, I had only Saraswati and Nirmala ma'am's numbers saved. Unfortunately, I think Sindhuja ma'am and Nirmala ma'am's number saved. So I've sent the Tele-Yoga NIMHANS link. If any of you would be interested in joining that, then I think they can share it with all the Face Me members if you want to join for any online sessions of yoga from NIMHANS. So the entire concept of yoga for mental health from a social research perspective came in because Western models of psychotherapy, you are aware of the Western models of psychotherapy like psychoanalytical therapy, problem solving, family therapy, behavior therapy, all of them came from the West. Including the contemporary work like cognitive behavior therapy, interpersonal and emotional focus therapy, strengths-based approach, and all. So we hardly have anything from the Indian-based, indigenous culture-based interventions which have been developed for India. Are my slides moving? Are you able to see my slides?
Yes, ma'am.
Yes.
Great. So why is it important to have an Indian culture-sensitive intervention? One is that Western psychotherapy is quite alien to our culture and to our social cultural menu for multiple reasons. Some of the reasons are pointed below, especially with respect to confidentiality and privacy. In the West, especially, people are extremely individualistic in nature, whereas our very strength is the families, which I think Face Me has founded with. So our strength being the families, there is no individual secret per se, but whereas we have family secrets, and we are very much an interdependent society. So in which case, if someone has to go to a therapist and try discussing aspects, then the concept of, whether we can hide it from your family, how private can it be? People also have those boundaries of digressing family privacies and talking to people who are third persons. The other aspects are about taking independent decisions, because a lot of our decisions are dependent on families, including, in the West, people launch out after the 10th and they take independent decisions to stay, to get married, to decide. Whereas in India, still a lot of our families are involved in decision making with respect to marriages, with respect to career options, which there's nothing right or wrong about. We're just talking about different methods in which cultures behave. So personal decision taking is extremely important in psychotherapy. And if I'm not able to take personal decision making and I expect my therapist to take decisions, then I can never get empowered. that becomes a problem in Western psychotherapy. Also, the distance between a doctor and a patient is quite huge in the Indian setting, because most of the times they feel that things which are in the family should be within the family. So why should we go and talk about it to a third person? Whereas it's very, because the family system is not very strong in the West, they don't mind going and talking to someone as a third person, because they actually want to ventilate and talk to someone, and that's the only therapist who's available. A third concept is about the concept of Indian concepts like the karma, the rebirth, where people believe a lot in external locus of control. And they say that, it's because, of my vidhi or because of my karma that I'm suffering this right now. So if there is a lot of external locus of control, according to psychotherapy, you have to have internal locus of control to learn to change. And if there is no internal locus of control to change, then possibly psychotherapy falls flat, because the person is not in a position to take decisions to change on their own. Because of this, there have been a lot of sources of psychotherapeutic constructs in the Indian philosophy. And we've had a wonderful paper that has come out on religion-based interventions, which my student Shaya Kurhade and I have published. If you type on Google religion-based interventions by Aarti Jagannathan, I think you'll get the paper. It's available freely online. And you will see how we have reviewed interventions in different religions, from Christianity to Jainism to Buddhism to Islam and to Hinduism, of course, where they have used tenets of the religion to make religion-based interventions. For my presentation, since I've mainly worked with Indian and especially Hinduism-based interventions, I will look at those interventions, including yoga, in my presentation today. So the first is the Bhagavad Gita, which all of us know is a discourse between Lord Krishna and Arjuna, where Arjuna was supposed to be depressed, and Krishna, akin to a counselor, helped Arjuna to come out of his distress and fight the war again. Why is this akin to psychotherapy? If you observe the Bhagavad Gita, across the 18 chapters, nowhere is warfare discussed. So nowhere Krishna talks to Arjuna about how to do the bow and arrow or how good a Kshatriya he should be. He only talks about the being of Arjuna, how he can become a better human being, how he can relate to his family members, how he should relate to self, others, and the larger community, which is what Beck's model of triad for CBT talks about. So overall, he's talking about changing the being in Arjuna, so that someone who's depressed is actually able to come out and take the bow and arrow and fight for a cause. And hence, we look at it as akin to psychotherapy. The Upanishads, again, talk about the karma and reincarnation, which helps us to become self-aware. Now, how is this karma and reincarnation important? Because the karma theory says that you have a moral responsibility to be good, because only if you're good in your current life, you will not get a rebirth and become a lesser human being in the next life. So if you don't want to suffer in your next life and you don't want to get reincarnated, you want to attain moksha, it's your moral responsibility to be self-aware and to be objective about your current living, which is what also counseling talks to us about becoming self-aware. So all this was spoken about decades and millions of years ago. The Vedas, again, the Rig Veda and the Yajur Veda talk about both positive and negative emotions, which is very important in counseling and psychotherapy. And the Yajur Veda talks about self-esteem, self-worth, and allows us space to be creative, to be happy. So, the concept of being happy and what we should do in order to become happy, which is what, again, counseling talks about, is discussed in the Yajur Vedas. I'll go on to talk about Vyadi according to Indian philosophy, where Vyadi or disease is spoken about violation of laws of nature. Now, what do they mean by that? They talk about the fact that if we do anything which is against the laws of nature, for example, according to our body constitution, if our body constitution says that I should not be having junk food, but I violate that law, there is a disintegration. So I have a stomach upset, because of which I have physical aches and pains, and it also affects me mentally. So it leads ultimately to psychosocial disturbance or vikshepa. Similarly, if you're standing in a posture, yoga posture for many, minutes or hours, then obviously that part of the body will pain, because according to laws of nature, you have to stand in a particular, normality according to the norms of, Newton's law of motion. So you have to stand straight. So that's called as disintegration, psychosocial disturbance, and vikshepa. I'll go on to the Taittiriya Upanishad, from where the concept of yoga or the concept of Panchakosha Viveka has come about, where they speak about the primary cause of disease is bad thoughts. So if I have a bad thought against anybody or any person, illness or bitter feeling, it first affects me. So an example of this is that if you have charcoal in your hand and you want to throw the charcoal at someone, first the charcoal will burn you before burning anybody else. And hence, it becomes important that I first understand that I am the primary cause of bad thoughts, my body is. And if I'm able to deal with these bad thoughts, automatically ill feelings towards others, bitterness in the same body, or any psychosocial disturbances in the same body can get adjusted. So the solution for this is in the yoga through the 5 sheets of existence. So they call it the Panchakosha Viveka, according to the Taittiriya Upanishad, where you have 5 sheets of existence, very similar to what Roger gave many, many years ago in the Rogerian system and the Maslow's system of hierarchy, where we have the Annamaya Kosha, the physical level, the Pranamaya Kosha, the Pranayama level, Manomaya Kosha, the mental level, Vijnanamaya Kosha, the intellectual level, and the Ananda Kosha. So yoga prescribes asanas or physical exercises at the Annamaya Kosha to improve the physical health. Pranayama practices or breathing practices, life force for the pranayama or the pranamaya kosha. Now, the pranayama is extremely important. The pranamaya kosha is extremely important because it controls our emotions. How are emotions controlled? Because if you observe, when you're extremely agitated, or when you're crying, or when you're angry, your breath is extremely fast. You're talking extremely fast, and it shows that you're agitated. Now, when your breath is controlled or when it's slow, then you automatically become calm. So pranayama gives the opposite philosophy. It says that if you're able to control your breath, you automatically control your emotions. So instead of my emotions controlling me, I'm controlling my breath, through which I can control my emotions. So the likelihood of you getting upset or emotionally disturbed becomes very less if you regularly practice pranayama to control your breath. Manomaya Kosha is the dhyana or the meditation part of it. Vijnanamaya Kosha is the intellectual discussions that Adi Shankara spoke about, where we have intellectual discussions on what is right, what should be done well, the rules and regulations. And the Anandamaya Kosha, that if we are able to follow all these sheets of existence, we can achieve bliss, or what Maslow talks about, of possibly the experience of self-actualization that Maslow talks about. So ultimately, we're talking about psychotherapy using the Indian concepts of philosophy, Ayurveda, as well as yoga. I'll be firstly talking about psychotherapeutic work, some of the work that we have done using Indian philosophy and the myths and mythological texts, and I'm talking about yoga. So the first work that we've done in counseling techniques is from the Ramayana. We've published about 3 papers in this, which is available in the Indian Journal of Psychiatry, as well as the Indian Journal of Psychological Medicine. It's available if you type Aarti Jagannathan and Ramayana-based counselings. We have used the text of Ramayana, Valmiki Ramayana, and we've reviewed the Ramayana to cull out counseling techniques, to validate socio-culturally relevant counseling techniques with the help of experts. And we have tested this counseling methodology to improve the well-being of persons with common mental health disorders, especially those with anxiety and depression. Some of the examples that I can give you. So what we have done is we've taken anecdotes from the Ramayana, that's stories from the Ramayana, and we have classified them. If you read some of our papers, we have classified them into various situations. Like, if someone is depressed, what are the stories that you should say? If someone is in grief, what are the stories? If someone has anxiety, what are the stories? If someone is in lust, what are the stories? So based on different emotional states, what are the various stories that you can reflect back to them. Now, these stories are such where one character has feelings of inadequacy, or one character is in a compromised situation, and another character in the story lifts up the morale of the other person and gives them ideas on how they can change the being in them and become better human beings. So one of the very famous stories is of the Hanuman complex, where Hanuman is given the task of finding Sita. So he reaches the seashore of Rameshwaram and with the monkey troop, and he understands that he has to cross the ocean in order to go to Sri Lanka. He suddenly has feelings of inadequacy, and he feels, I'm just a small monkey. How can I fight all the demons on the way and go lunge to Lanka? So he has all the concepts of cognitive distortion. He has overgeneralization, he has selective abstraction, he assumes excessive responsibility that if I don't go, then what will happen to Rama? Start catastrophizing what will happen to Sita, will she die if I don't go, assuming temporal causality, all the cognitive distortions possible in CBT that you can observe. And Jambhavan, who is the minister in Sugriva's fort, who is over there, actually focuses on his potential. He does something like a strengths-based intervention where he talks to Hanuman about his strengths, and he tells him that you're Vayuputra, you're the son of wind god. In childhood, you've actually lunged and jumped trying to catch the sun, assuming that it is a mango and you want to eat it. So if you are not able to lunge, then no one else will be able to jump the ocean. So he basically reflects all his positives and his strengths to him. And then, of course, Hanuman changes his mind, and next is history in Ramayana. Similarly, you have a couple of other stories like where Lakshmana misinterprets Bharata coming to meet Rama when they are in Chitrakoot, and Bharata gets to know from Kaikeyi that Rama has been banished, and he comes to take Rama back with the entire army of Ayodhya. Lakshmana, on seeing the army, believes that Bharata is coming to fight them. And he picks up his bows and arrow and he tells Rama that, come, let's go and fight with him. Again, cognitive distortions on his side, generalizing that if the army is coming, it's coming to fight, white and black thinking, filtering only what he wants to assume. Whereas Rama counsels Lakshmana, saying that it's not necessary that Bharata is coming to fight with us. He may be coming to talk to us as a brother. So why don't you give him a chance? And of course, Bharata had come to take them back, and he takes his slippers back. So there are a number of stories like that which you can read in our papers. I don't want to spend too much of time in this, which we have used with persons with common mental health disorders and found significant effects. The publication effects have been talked about in Indian Journal of Psychiatry, which recently been published last month by Chhaya Kurhade and myself. I'll move on to yoga, which is the main theme because of the International Yoga Day. So yoga emphasizes prevention, protection, and resistance. Basically, it helps through various stretches. So stretching and the contraction through various asanas. It helps to purify nerves, body, mind, and intelligence. And it helps to flush toxins. So the the various things which get flushed through our various outputs. It also helps to control the mind and the breathing. So yoga, as you know in the definition, is yoga chitta vritti narodha. That is to help gain control over the mind and to control over the original state. What do they mean by the original state? When you were a baby in the womb of your mother, you felt extremely protected because your original state was where you had control over the mind. You didn't have too many thoughts. You were able to concentrate on only eating and feeding, and you were able to remain silent and hear the silence of your mind. So can you get back to that state of shunyata? Is what they say. So attention is moving from many to one stimuli. Many stimuli is right now you're able to hear my voice. Maybe if someone unmutes, you can hear their voice. You can hear some sound in the background in your house. So there are multiple sounds in the background. But if you're intensely connected to me, one is that you are having attention. So many sounds to one sound, which is only my sound, you can hear. So you're moving from many to one. And moving from one to none is when you're so engrossed in my lecture that you don't know that we have finished almost 25 minutes of the talk. We started at 6:05 and now it's 6:30. So, you don't know concept of time, space, and person. You don't know where you're sitting. So someone has to knock you and tell you that, hello, you're sitting over here, and then you realize, and then someone has to ask you what your name is, and then you realize. So that's becoming a state of self-actualization, or state of silence, or state of no thoughts, where you lose sense of space, place, and person. So that can also happen in yoga when you're so concentrated in doing the asana and concentrating on body and mind that you can reach a state of shunyata or self-actualization. So yoga helps in treating the patient or the person, then the disease. So we look at building the native resistance and changing the atmosphere, changing the behavior and the attitude more than, changing the disease or, increasing any other threshold of the disease. So I'll give you a few examples that we have done work in where I have been particularly involved in, and this spans studies for users, PMIs, as well as for caregivers. I'll be dealing with both. By caregivers, I specifically mean family caregivers, because most of the studies that I've been involved in are family caregivers. So the first study that I was involved in is yoga for persons with schizophrenia, where it was a randomized controlled trial where we have divided persons with schizophrenia into 3 groups: yoga, exercise, and weightless group. Weightless group did not get anything, and we provided yoga for 1 month period, and we assessed them at day 0 before they joined the yoga or exercise or weightless. Exercise is more the PT exercise that they got in school. 2nd month and 4th month we followed, and we assessed them on their symptom status, on their occupational functioning, and the trends, which is basically for cognitive functioning, on how well they're able to look at cognition. So there are 2 papers published out of it. The citation is given below, and you can type on Google and you will get these citations, where you have significant positive correlation between cognitive functions and socio-occupational functioning. Also, over a period of time, we realized that those who practiced yoga had lesser symptoms and better socio-occupational functioning and better cognitive functioning. The maximum improvement was over a period of 2 months of practice if you consistently practiced yoga, and improvement in symptoms were observed if you consistently practiced for about 4 months. So ideally, between 2 months to 4 months of continuous regular practice is when you can see any results in yoga. We then went on to study what are the barriers in yoga. Why do people with persons with schizophrenia or users don't come in for yoga? And we realized that a lot of them find it difficult to come to a particular place to practice because of a lot of reasons. They may have side effects of medicines. They may find it difficult to get up in the morning, and no one is there to accompany them. They can't travel alone, or the patients themselves are going for work. Users are going to work on their own. Or they're not, very few people said that they're not willing to come for yoga or any personal reasons or due to religion. So most of it was more because of logistic reasons. We published the paper again, which is down the citation, and you can type it on Google and get it. We then went on to look at caregivers and family caregivers specifically and try to understand why, they don't give too much of attention to their health. And this was basically for inpatients, family caregivers. We initially assessed their needs. We developed a yoga program and a psychosocial program. And then we pilot tested and did the main study. So in the needs assessment, since they were inpatients, they were admitted, most of the family caregivers said that you first teach me how to take care of my user. You first make the person socio-occupationally functional, and then you take care of my health. So it's only 3rd priority is my health. You first take care of them, and then you take care of me. Of course, there were other needs for social welfare benefits and marriage and other things that came in. So based on this, we developed 2 programs, psychosocial program as well as a yoga program, which caregivers can do to take care of their health and also teach their family members, their users, so that they can also take care of their health. I sort of shared a yoga program. So we developed 2 and we tried a feasibility testing. The publications of both the programs are given below in the citation, which is again available online freely that you can look at. If you type my name and write yoga, you will get all these citations. We then went on to do a randomized blog design, which is the highest order of trials in research, where we had 137 family caregivers, where we recruited them, and approximately 4 to 6 caregivers in one group either went through a yoga program alone, a psychosocial counseling program alone, or a combined program of psychosocial and yoga, or a 4th group which did not get anything. So 4 groups, we assessed them at the end of 1 week of the program, 1 month of the program, and 2 months follow-up. This was the cohort, so how we enrolled the people. We assessed them on burden, coping, anxiety, depression, social support, and their knowledge. And we realized that over a period of time, participants, I mean, family caregivers who were part of the combined group obviously had better coping, had better knowledge. But when you compared both the yoga and psychosocial group, it was actually equal. So that meant to say that if there were not enough mental health professionals in the space in any area, then we could use yoga therapists as an alternative intervention to help caregivers and family caregivers deal with coping and deal with their family members and users. We also then went on to test another program with the help of ICMR, where the previous one was mainly for inpatients. We said, what if inpatients are extremely symptomatic? What if we look at outpatients, who are the majority of the people who are in the community? What about their participation, and how is it that we can help improve their resilience? We have the paper published down, and we brought out a manual and a brochure, which is there on your screen. And we looked at 60 family caregivers, 13 yoga group, and 13 care as usual. And we asked them to come only once a month when they came in for the follow-up with their user. And we provided them a VCD, a video to practice at home. Of course, the adherence was not very good. We had to continuously keep calling them. There was 35% attrition at the end of 1 month and 14% at the end of 5 months. But those who continued practicing, we realized that their stress reduced, and also they felt much more resilient, and their burden reduced by practicing through the self-help manual. We then went on to look at virtual yoga or tele-yoga, and this was much before COVID that we tried. We have an NIMHANS Center for Wellbeing, and we have an NIMHANS Center for Integrated Yoga. We tried at that point of time in 2016, 17, we had only Skype and Hangouts. Zoom had not yet come out. So we used Skype and Hangouts to look at relaying the yoga sessions from NIMHANS Center for Yoga to NIMHANS Center for Wellbeing. And then to each of the users, we had persons with common mental health disorders, having anxiety, psychosomatic disorders, depression, and we tried doing it, relaying it to each of their houses and seeing whether tele-yoga works. We also developed a virtual yoga trainer's assessment, assess whether the virtual yoga trainer is doing a good job or not, because it's a tele-yoga thing. We got very positive feedback. The publication is below about tele-yoga therapy and the need for assessment tool and guidelines. Based on this, the tele-yoga guidelines were released in 2020. NIMHANS, the Integrative Medicine Department, I myself, along with my team, along with SVRC University and the Ayush Ministry, were instrumental in bringing out the tele-yoga guidelines. This is available on the Ayush Ministry website and in the Indian Yoga Association website. Actually, if you type tele-yoga advisory guidelines or tele-yoga guidelines on Google, you will get the PDF very easily. And I would suggest that if any of you plan to join yoga, then please look at the advisory, read through the advisory, be equipped with the advisory before joining any yoga practices. Further, from NIMHANS, since we have done so much of research over the years, our team and my mentors have done, from Dr. B.N. Gangadhar to others who have worked in this space, to Dr. Jagdisha, to Dr. Shivram Varambali have worked in this space. We have, through research, we have developed specific yoga programs for each disorder. So, reviewing texts of yogic texts like Hatha Yoga Pradipika, Ghiranda Samedha, we have looked at what practices are best for users with schizophrenia, with anxiety. So, we have separate packages for anxiety, separate things for schizophrenia, separate for bipolar affective disorders. So, it's important to know, because in case of clients with schizophrenia, we have found through research and also through fMRI studies that too much of inward practices are not good, and it should be more dynamic, and hence the packages are more dynamic. Whereas for anxiety, it needs to be a little more inward and slower. So the practices are much more slower, including more of pranayama. So it is good if you follow separate intervention packages which are available and tested and tried out for each disorders. I've also sent the link for the tele-yoga sessions conducted by the Department of Integrative Medicine to both Nirmala ma'am and to, I think, either Saraswati ma'am or
Sindhuja, I received it.
Yeah, so please share it with others, and if anybody is interested, they could join in. You could also visit the integrative medicine website on NIMHANS website and contact the email ID if you want any specific packages or training in any of your anxiety or schizophrenia, any of the specific disorders. They could possibly help you out and guide you. You may need to come for 1 or 2 sessions, and then they will help you with the online sessions. Next, we tried for yoga for depression, and this was more like an implementation science work, a qualitative study where we wanted to find out what works, why does yoga work? Is it because of only the intervention? Is it because of the therapist, or is it because of the participant? The participant is extremely excited. So we found it's a combination of all factors which works and not just the yoga intervention. And hence, when we look at yoga intervention, the therapist has to be good, the intervention should be suitable. So you have to have the right pill, you have to have the right person to administer the pill, and you should have the correct person who has the correct diagnosis. Otherwise, it doesn't fit in at all. This paper has also been published, and you can have a look at it to understand decoding integrative approach to yoga therapy. I mean, what is the integrative approach and the qualitative evidence behind it. We had another very interesting study for elderly. And as I know, most of the families are, in their elderly stage. I thought this was very exciting that we did. We did this in Goa with one of my students, and she did it in 2 old age homes where family caregivers who were staying in the old age homes had mild cognitive disabilities. So they didn't have dementia, but they had mild cognitive disabilities. Because of old age, so it was not a diagnosable disorder. And we had a randomized block design where one old age home was provided Trataka. Trataka is an intervention yoga where you look at a candle flame for about 30 minutes as a procedure for doing that. And the other group did not get anything, just asked to sit and rest. So when we provided Trataka for 26 days for 1 month, we realized we assessed them on various cognitive functions for attention, for working memory, also for executive functioning. And we realized over a period of 1 month, the intervention, the Trataka group scored significantly better on SLCT, that is the attention, as well as TMT, which is executive functioning, that we found in the elderly. So Trataka is another option that gives just a 30 minutes practice, but of course you need it to be guided so that you are able to get in and get out of the practice. Recently, we have got a huge grant from the ICMR called the YES project, which is the yoga-based extension services, which we have launched just this month on the 10th of June in 2 taluks in Tirthali Taluk, Shimoga district, and Turbikere Taluk, Tumkur district, for persons with severe mental disorders in both cohorts. We have been running these cohorts for more than 15-20 years. It's one of Dr. Jagdish's pet project because it's his hometown, and he's been wanting to give back. So for the past 20 years, he's been supporting the cohort and providing monthly medications and rehabilitation inputs. We have a very strong cohort of 250 plus, both in Tirthali and Turbikere, who come to us regularly for follow-up, for adherence and for rehab inputs. We have MRWs, VRWs working. And now we're going to add on yoga, 6 sessions once a month when they come to the PHCs. And also provide guided, training by the yoga therapists and accessible yoga videos, brochures, so that they can practice at home. We are expecting reduced symptom severity, improved daily functioning, and better physical and mental health. And we have just launched this project on June 10th, and we're initiating it for the next 3 years in both the taluks. So we are moving to the rural areas to see how yoga-based extension services can be provided. So the take-home message from me, I will stop with this to ask any questions from the audience, is whether yoga is effective as an independent or add-on. We usually say it's an add-on to pharmacology, unless it is common mental health disorders, and some people feel that medicines are not required, but in most cases it's an add-on. Compliance to yoga is very important. So as you've seen in most studies, it's either 2 months or 4 months, because in 1 month, some studies have worked, but you can't do it for 1 day and then forget about it. Establishment of community yoga groups, like what we have done in the YES, because so that users can get, acquainted in their own communities to get trained, and they don't need to come to a tertiary care center like NIMHANS, can become an accessible, affordable, and available quality mental health care service and treatment in the Indian community. So thank you so much. I hope you've got a fair idea of the work that we've done, and I'm available on email, and I'm also available for any questions right now for the next few minutes. I'll stop here and hand over the mic to the organizers. Thank you.
Thank you so much, Dr. Aarti. Anybody would like to ask any questions?
Madam, I would like to ask whether schizophrenia person can do meditation for 5 minutes.
According to the yoga program that we have, we usually say it is not advisable because research has shown that any practices which are inward can help only increase the hallucinations and delusions. So it would be good if they do more dynamic practices than inward practices.
But we can do pranayam, breathing exercise.
Breathing exercises, I would suggest that you look at the packages. I'm not a yoga therapist, so it will be good if you can contact the Department of Integrative Medicine on the website and ask for queries, and they could share the package, and it will be good if you can follow that, then looking at generic practices which are available.
Thank you.
Anybody else would like to ask a question? You can unmute yourself and ask, or you can raise.
The presentation was so good and with clarity and a lot of evidence-based findings that Dr. Aarti has provoked us all to think rather than raise questions. That's my experience. Yes.
In fact, I'm like all geared to read all your research papers now. So that's my next agenda. And, honestly, one didn't know that there was so much of work which is being done on this. Yeah.
I mean, when you're not, Dr. Aarti, Saraswati, can I ask a question? As we are talking, I got this question.
Yeah,
Can
sure.
I ask? So this yoga and psychotherapy are not opposites, right?
No, they're not at all opposites. We are looking at different methodologies that can be offered. So you can also do yoga, you can also have psychotherapy. We're looking at various additions to what can be done to help the user and the family members.
Yeah, because one thing that personally has bothered me both as an individual, I mean, I'm basically Hindu, so I'm brought up in Hindu traditions. So you can't escape knowing about Punarjanma and your 7 births to be a Brahmin, all those things.
Yes.
And karma and the things. Especially my aunts are all deep down in history, so they know only this. Now, how do we give evidence? Of psychotherapy is evidence-based, concrete. Approaches to scientific thinking is different in religion as compared to. How do you tell a patient, suppose the patient is not from Hinduism, first of all, how do you use this? That's my first question.
Yeah, I think a very interesting question, and we had a huge debate over here in the department also when we presented Ramayana-based counselings. And I remember Dr. B.N. Gangadhar because Sir was our mentor for this whole thing. Sir said that...
I didn't get your name. I didn't get the name.
I said Dr. B.N. Gangadhar was our mentor for this.
Gangadhar.
So when Sir, he answered this question very eloquently, and I'd just like to quote him. He said that instead of Rama, Sita, Hanuman, if I put Peter, Sam, and Joey, and I still told you the story, and I just gave you anecdotes of the story, you may not even know that it is the Ramayana.
Right.
So the issue is not about Ramayana or religion. The issue is about how the stories can make an effect, because in each of the anecdotes, there's a character, there is a context, and there is a solution. And we are looking at the context, the character, and the solution, and not that this is a religious text which is being used by a particular religion.
Oh, so
Yeah,
beautiful.
yeah, that's a brilliant.
So he
And my
very
second
clearly said
question,
that,
sorry.
actually, if he had published research saying that it was in some Christian name or some Islamic name, possibly you would have not raised questions. Because we are saying Ramayana, you're raising questions. So it's more the context that is important and not the names of the people over there.
Right. That is, yes, lot of food for thought there. The second thing related to that one question is, even if the person is a Hindu, how do you convince the person about these are very old, ancient, so many people have raised this question, nothing very original about it, nothing novel about it. But how do you convince a person about Punarjanma and how do you relate it to the yogic practice or the discipline of yoga? How do you, is it a very
So
complex
we
question?
don't discuss about Punarjanma. We look at it as
Yes.
a concept to help improve self-awareness. So
Okay.
mainly the concepts of karma and rebirth, not the Punarjanma part of it, but more of rebirth, because the karma theory very clearly says that, if I'm morally good today, then the likelihood of me achieving moksha or not having a rebirth is there. So for my own selfish reasons, I have to be aware and be good today, so that tomorrow I'm not having a rebirth or I achieve moksha or
But how
salvation.
do you convince your client? The client also is from Hinduism, okay. But the client may be a radical, a rebel.
Correct. So then all concepts are not used for everybody. And I would be happy to say that in this
Yeah.
paper that was published using the Ramayana based interventions, we had clients from the Christianity religion. We also had clients from the Jainism and Buddhism religion. So it was not that people were all Hindus. And they were also able to understand the context and the outcome of what the characters were talking, and not necessarily the characters who were associated with them. So I think we very clearly delineated that these characters could be any other characters. You look at the story independently and forget about the characters part of it.
Right. Thank you so much, Dr. Aarti.
Yeah, I think
Yes,
someone has asked a
Saraswati, over
question
to
in chat.
There is one question from Vimla. Is that your yoga sessions need to be conducted at a time which suit the PMIs? Many of them wake up late in the morning because of the medication, I'm sure. Hence, can evening sessions be conducted for the benefit of our loved ones?
Correct. So as of now, we have a 900 bedded hospital. So we cater to 6 lakh clients annually. So as of now, we have only one tele session in the morning. But however, if you do get referred to the integrative medicine department, there are various other tele sessions that are going on for people who are registered with us. So if you are interested, then I would suggest to you to register with the Department of Integrative Medicine. You can find the details on the NIMHANS Integrative Medicine website. And you could come in for a few sessions and then also take in videos home. We don't insist that you need to, do that. But currently, this is a tele session which is available for general public. Otherwise, we don't have any other session apart from this for general public. I am aware that SVYASA University has a number of programs as well as tele sessions. You could look at the SVYASA University website also to check if there is anything specific for persons with mental illness.
Please repeat the name of the second university.
Swami Vivekanand Yoga Anusandhana
Okay.
Sanstana,
Yes.
SVYASA University.
Yeah.
Any other questions? I think everybody is trying to internalize what you have actually shared. And thank you so much, Dr. Aarti. It was, I don't know, I don't have words to articulate, but it was an eye opener to at least to me, and I'm sure to all our audiences. Like I said, so much of work being done, and we are unaware of it. And even that you have an advisory, document, which I think we all of us need to go through it, and so that we not only take care of ourselves but also our loved ones. So thank you so much, and I hand it over to Sindhuja for the pledge.
Thank you for inviting me. It's been a pleasure always to be with this.
Thank you, Dr. Aarti. I think there is one more person who has written in the chat box that sometimes it is not advised for people with mental illness to do yoga or meditation. I think there is always this, I think we associate yoga with meditation also, not just the asanas. So there is, because as you mentioned, even for my brother, it was when there was some interest shown in mindfulness, his doctor advised him not to, experiment with that. But yoga, yes.
We have very solid research evidence to say
Yeah.
persons with severe mental disorders that
Yes.
practices like meditation, mindfulness should not be done. But yoga, definitely yes, especially if you're looking at the dynamic asanas, because there is evidence to show, as I showed you, that there is symptom reduction, socio-occupational functioning, and negative symptoms especially improve significantly with yoga. So what is the yoga package that you're doing is what is important, which we have
Yes.
and study. So if people are interested, they can reach out to the Department of Integrative Medicine.
Thank you so much. It was a pleasure to listen to you. And my brother has also been trying to do some yoga. He has been diagnosed with schizophrenia. But his movements are very restricted in the sense that he doesn't move freely, which he said that many of the other people with whom he's been doing yoga, who also are under treatment, the freeness of movement is not there. That's what he said, and he is not very flexible in spite of doing yoga for more than a year. Your input on yoga now, I think, would it interests me to put him
at least in IMD,
in a package which would help him.
In IMD, at least I have seen a lot of people who have not been flexible. But I think what's important is how much they are, more than the flexibility part of you. It's more about how they are, one, when they're doing the practice, that is, the mind-body coordination, and also how much they're able to maintain the postures, even if the flexibility is not there. So, it's more about contractions and the, stretches than actually being completely like a rubber ball. I don't think
Yeah, no. No, not to that extent, but yes. Also, I saw the difference when my brother was that the discipline of doing the exercise for that half an hour or 40 minutes that he was doing on a daily basis, which was part of his routine, which was not there earlier. So continuation of that was really helpful. So thank you very much. We will continue with the pledge. Saraswati, if you could put up the pledge, share.
Yoga help with severe depression. Yes, we have got a number of biochemical as well as genetic studies which talk about yoga helps in common mental health disorder, mental health as well as severe depression. So it is.
Have the Face Me pledge on the screen now. I request everyone to mute themselves and read the pledge along with me, but on mute. Thank you. The Face Me pledge. We, the members of Families Alliance on Mental Illness Face Me, pledge to support one another and other families in similar situations and use language which conveys love and respect towards each other and especially towards PMI. We shall strive to protect and promote the rights of PMI as enshrined in the laws of the land. On this day, we take this pledge to work towards the vision and mission of Face Me. Thank you. Thank you very much.
Thank you, Dr. Aarti.
Thank you. Have a nice day. Thank you for calling.
Thank you,
Dr. Aarti.